Dental appliances come in a various number of configurations that can be used to treat patients. This is an example of an appliance that fits over the lower jaw and the upper jaw, and it's one piece. So it locks the jaw into one place and the patient cannot move. Some patients tolerate this very nicely, and some people cannot tolerate not being able to move the jaw. This is a different appliance that's used to treat apnea. It also covers the upper jaw and the lower jaw, but these two are not fused together, so the patient is able to open their mouth fully. They can talk while they wear this appliance. They can drink liquids while they wear this appliance. This is very good for people who have claustrophobia. This is a very popular appliance that we make a lot of. Once we make an appliance for a patient and it comes back from the laboratory, then we'll have them in and we'll insert the appliance, be sure it fits, be sure it's comfortable, go over with them very carefully how we want them to use it, send them home and get them started that night. Most of the time the benefits are pretty immediate. That first night their snoring's gone. They wake up feeling more rested. Sometimes we have to adjust them, and more than once, one time. It varies patient to patient, but over time, those patients who do need adjustments, we're able to do that pretty easily. When we do an examination and take the records to start one of these appliances, I try to estimate as closely as possible the best jaw position for a patient. But as their muscles and joints relax over time, we are able to adjust this appliance and move it more forward as they accommodate to it. So where we start from is not where we have to end up to, and we are able to adjust it to improve it as time goes along.
Having sleep stage done here locally in Valdosta, Jacksonville, Florida, Mayo Clinic, and Atlanta, I've been told several times that it was borderline that if I was not living here in Georgia, that they would pull the driver's license with it being excessive and no treatment, no remedy was working. Different pills, different medications, CPAP machine was not working, not giving any benefit. Me personally, I think it was exasperating the issue and making it worse. This was pretty much my last stop effort to get some kind of treatment and remedy, was coming to see Dr. Clements and his staff. Like someone with sleep apnea, you usually find between 11 in the morning, I'd say 3 in the afternoon, 2 in the afternoon is your hardest time to stay awake, and that's when the tiredness hits you the most. I'm able to get through that without falling asleep at work. I'm driving more now, not as afraid to drive around town or anything. Before I leave my house and drive 20 minutes to the mall, I'd pull off in the parking lot and sleep before I got there. Just couldn't stay awake. I'm no longer snoring at night, which was a blessing for my wife. Very hard to sleep next to someone who's constantly snoring and keeping you awake. So it's made life a lot more tolerable for her as well. Coming to see him and all of the staff here is probably one of the best things anyone ever suggested. When he heard about the problem and he was wanting to start this device, he asked my doctor and me, would it be all right to meet with me and try this new device. And I was kind of hesitant about it. I couldn't honestly see how wearing a dental device was going to improve anything, but it's really changed my life, my lifestyle, marriage and family style. For anyone that's got severe sleep apnea, that is having a hard time wearing the CPAP machine, they would probably understand better than your average person that doesn't have it how much of a benefit this device is.